Okay, hello everybody and welcome to this month's exciting installment of the EPA's Computational Toxicology Communities of Practice. I am Sammy Hamp. I'm a student services contractor here at NCCT. Today we'll be hearing from Dr. John Wambaugh about the Systematic Empirical Evaluation of Models, or SEAM framework. Before we begin, I just want to let everyone know, please mute your lines. If you're doing that through a phone, you can accomplish that by hitting #6. And if you have any issues with the audio, let us know in the chat, and we'll try our best to get that resolved for you. With that, I will go ahead and share the screen and turn that over to Dr. Wambaugh.
All right. Thank you for everyone who is brave enough to tune in for a webinar with this title. I admire your commitment to computational toxicology. So I did add a subtitle that, we're looking at high throughput exposure science for chemical decision making. I do have to state that, I'm speaking to you as a scientist. I do work at the EPA, but I don't necessarily make proclamations of EPA policy, nor should you ever think that I do. I'd worry about you. But anyhow, so why are we here? I mean, and this is, I think, generally applicable to the computational toxicology across the board, is that if you take samples of blood, you can see evidence of thousands of chemicals in that. Now, a lot of those chemicals are blood. They're cholesterol, urea, various proteins that make up your blood. You would be very sick if you didn't have the chemicals that are endogenous to our metabolome in your blood. However, there is some evidence that some of those chemicals do appear to be man-made. And by some, I mean hundreds to thousands, usually at very low levels. But of course, low is subjective, and toxicology is all about figuring out what does low mean. And so I've got this cover from the New Scientist magazine on the right-hand side of the screen, and they've got the headline, and you can quibble about the exact number, but they say we've made 150,000 new chemicals. We touch them, we wear them, we eat them, but which one should we worry about? And so they give an example of an apple, lipstick, and a red shirt. And so the shirt in particular I like to pick on because you can think about it, that shirt might have a label that says 100% cotton. That refers to the fiber. If the shirt is red, it turns out it has red dyes in it. So you know that it's not 100% cotton. If the shirt is legally sold in the state of California, it has sufficient flame retardants that I can take a blowtorch to that shirt and hold that blowtorch to the shirt for 12 seconds without it catching fire. That requires a heck of a lot of flame retardants. So that could be 20-25% of the weight of the shirt are these flame retardants. So that 100% cotton shirt could have some interesting chemicals in it. In the United States, we do not have a single safe chemicals law. We have a tapestry of laws that stitch together, and in particular, if something's a pharmaceutical, FDA has significant testing requirements on how we evaluate a pharmaceutical. If something's a food additive, FDA has a different set of requirements on how we look at that. If it's a pesticide, the Environmental Protection Agency, this is a chemical designed to kill something. Environmental Protection Agency has all sorts of requirements for how that's tested. Most other chemicals, ranging from industrial waste to dyes to packaging materials, various types of preservatives and products we use, are covered by what's known as the Toxic Substances Control Act, or TSCA. And so just in case you're worried that, I'm kind of tinfoil hat weird here on that there's lots and lots of chemicals, basically we have a document from the U.S. Government Accountability Office. This is back in 2013, but they're basically saying that there are tens of thousands of chemicals listed at the EPA. We add an average of 600 new chemicals for the EPA to look at a year. And most of those chemicals have not had any assessment really with respect to exposure, toxicity, or toxicokinetics outside of they don't obviously look like a chemical that's known to be a bad actor. Chemical industry is very intelligent about that. You try not to design your new food dye or your new plastic dye to accidentally have it look like dioxin or something like that. We try to avoid those things. So in 2016, the U.S. Congress, in a bipartisan manner, actually updated the TSCA law, as it's known as the Frank R. Lautenberg Chemical Safety for the 21st Century Act, and basically required EPA to do more evaluation of those sorts of chemicals that were grandfathered in, that are on the market, And in order to do that, we really need to adopt what are known as new approach methodologies. It's the current buzzword. It'll be a different buzzword in 2 years. The idea is important. It's the idea that's important. It's not the acronym. But NAMs are what we're using, and I will be talking to you today about exposure NAMs. And there's a document released just in September of last year on a working approach for identifying potential candidate chemicals for prioritization. And if you wonder what this blurry, weird-looking thing on the right-hand side is, this is the actual bill from Capitol Hill, for those of us who are exactly my age and know Schoolhouse Rock. But this is the bill that is the Frank Lautenberg Act back in 2016. Okay, so we're here on the CompTox community of practice. We need 3 bits of information really to do a risk assessment, or to do chemical risk assessment. And that's not my opinion on that. This is National Research Council back in 1983 has the Red Book on how do we do risk. And they said basically you need some idea of the hazard, what the chemical might do at a sufficient concentration, some idea of the exposure, how much you actually get exposed to that chemical, and some idea of the dose response. Basically how do the effects change as you get more chemical in your body. I'm loosely calling that toxicokinetics here. There's actually toxicokinetics and toxicodynamics that need to be considered, but I don't know how to do toxicodynamics, so I'm ignoring that problem for the moment. So in CompTox right now, we have the ability to do high-throughput screening. This could be Tox21, this could be ToxCast, this could be somebody else's high-throughput screen. We have in vitro and vivo extrapolation. Barbara Wetmore and Rusty Thomas have led a lot of work on that. And we can actually predict a dose in milligrams per kilogram body weight per day that might cause adversity, or at least might cause bioactivity. And frankly, if a chemical is trying to make my shirt blue, I am not interested in having enough of that chemical in my body to be perturbing my biology. I just want my shirt to be blue. If there's a different color shirt I can wear to not perturb my biology, I would wear that shirt instead. So CompTox gives us hazard toxicokinetics. We need methods to forecast exposure for thousands of chemicals. And so this is not a new problem. There are lots of models. I'll go over some of them to do this in a high throughput manner. We also need to understand the pathways involved. But basically what I'm going to talk to you today is this third part of the triangle here on how do we get exposure numbers. And this is not a pipe dream. So National Academies back in 2017 recognized that basically translating high throughput data into risk-based rankings is an important application of exposure science. And they actually singled out kind of the ToxCast 21 paradigm coupled to high throughput models as a reasonable way to do it. And what this tends to look like is on the left here. I don't think I should have to tell anyone on the call that if I take ToxCast and run it through an in vitro and vivo extrapolation, that there's actually a lot of uncertainty in that. None of those tools are perfect. And so rather than think of it as we get a point estimate for, it's exactly 3 mg per kg per day will cause thyroid perturbation, you think of it as some sort of confidence interval around a mean value. Exposure is the same thing, except the uncertainty is worse. We don't have as many experiments as we'd like to have to assess exposure. However, if we have a whole bunch of uncertainty on exposure and we have a whole bunch of uncertainty on toxicity, but we've done a decent job of characterizing that uncertainty and there's no overlap between the two, that's not a terribly interesting chemical to look at. On the other hand, if the uncertainties overlap, whether it's because the 2 chemicals are really uncertain or just the estimates are right on top of each other, that is a more interesting chemical. And so these are the sorts of applications that we're thinking about in terms of priority setting. This is step 1 or even step 0 or step -1. This is identifying a chemical that's worth additional study. This is not a final deliberate word on these things, but it is very useful to screen out the chemicals on the left-hand side here, lower risk from the higher risk chemicals. The problem is that, and we do not have a lot of data on exposure. So Peter Igegi back in 2012 had a paper on the exposure data landscape. Thanks to a lot of work by some of my collaborators at EPA, Kristen Isaacs, Kathy Dionisio, we are in a lot better, and Peter Igegi, who actually led up a lot of the initial stuff, having written the paper and recognizing the problem, we are in better shape than we were, but generally this is still about ballpark of what we were looking at, where there are tens of thousands of chemicals, and note this is a log scale on the y-axis, tens of thousands of chemicals, so we know the production volume. We know that greater than 25,000 pounds are produced or imported, like gasoline import a lot of a year. So we know that there are a whole lot. As far as how that's used, we don't know as much. We know a lot more now than we used to. And when you get down to how much of that's actually in people, as far as we know this chemical is in a person at this rate, we're down to hundreds of chemicals. Now, hundreds is still a monumental amount of effort, but if we're saying that there's tens of thousands of chemicals on the market, we're talking a couple % coverage. So that's a real problem if you want to do the sort of prioritization I showed you. So what do we know about exposure? Well, in particular, we know we have biomonitoring data. And so for the Centers for Disease Control and Prevention have been conducting a National Health and Nutrition Examination study or survey for over 20 years now. It's a large ongoing survey. Now, they do a lot of biometric stuff, height, weight, cholesterol. This is how I figure out how much fatter I am relative to the rest of the United States. So far, the United States is keeping pace with my lack of appetite control, and I appreciate that, America. But generally, that's the sort of thing they're looking at. All of this data is public. It's available from the CDC. There's a link there. There's actually a survey package in R where you can actually pull in and do all the statistical weighting. It's pretty slick. They also do measurements of what chemicals are in blood and urine of the United States. Now, it's not every chemical that's there. It's a targeted study, but they have a list of a couple hundred analytes that they look for. And so they consult with the EPA and other organizations and say, what chemicals should we be looking for in people? And so we have that data from the Centers for Disease Control. We also have models of exposure. And so here at EPA and elsewhere, we've been coarsely grouping models into two categories, where one set are near-field models, where we describe near-field sources. So that could be, for those of us sitting in the room here, we've got relatively new tables, so they're probably still outgassing a little bit of chemical from the finish of the table, so we're breathing that in right now. That's a near-field source. If any of us have applied lotion, or I used glass cleaner the other day, I did not wear gloves and a face mask, and I know exactly what the ammonia D tastes like because I breathed a lot in. That was a near-field application, a near-field source of exposure. Then we have far-field scenarios where we also consider if there's a factory or some other environmental release, chemical might distribute through the environment in the water, the air, might be eaten by various animals and aggregate up the food web, and so that's a far-field source of exposure. And we really want to consider both those. And this terminology, as near as I can tell, goes back to John Arnott back in 2006. It's the first published thing I found on it, and this is kind of an ongoing bet to find early and earlier references to far-field and near-field. It actually goes back to antenna theory, because an antenna behaves differently if you're very close to it and far away. But as far as exposure science, that's the earliest reference I can find. So we have these exposure models to predict the exposure you get. Any one model is basically an encapsulation of some knowledge. You think of the chemicals that they had at the time, chemicals that they thought were important, and a theory of how the world works. Matt McLeod has a nice paper kind of describing that. And so there's an EPA website called ExpoBox. It's the exposure toolbox, and they've got many, many, many different types of exposure models. So, they get from very broad, like chemicals released into the environment, how much do we get from breathing the air, to very specific, this chemical is a delousing agent that you spray on a mattress, and then you sleep on the mattress, how much exposure do you get from that? So they go from the very, very specific scenario to the very far-off scenario. And so the whole point, summarized by a nice quote from George Box, who's a statistician, where he said, it would be very remarkable if any system existed in the real world could be exactly represented by any simple model. However, cunningly chosen parsimonious models often do provide remarkably useful approximations. The only question is the model illuminating and useful? So, and this gets back to almost the model train sense of model. If I'm building a model train set, I include the things in my model train set that I think are fun. I don't actually have a model train set, but if I did, I guarantee you I would not be making tiny little peanut butter and jelly sandwiches to put on the meal cart. That would seem ridiculous, silly, and beside the point. But I might paint trees because I think that's an important part of the model. So a model is a set of choices of what I think is important. For most of us, if you're making a train set, the track and the train is a big deal. But a model always represents a set of choices of what's important, what's not important. The problem with exposure is there's a lot of things that are important. And then I've lost my acknowledgement of Kristen Isaacs on this slide, but she put this slide together. And it's a real good snapshot of everything that's going on in the exposure universe. So a chemical can be used in manufacturing or processing, might go to a different industrial use, might be released to the environment, like on the right-hand side here, it might end up in consumer products. So we get back to that surface cleaner, that I was spraying on the window without gloves, or something in flooring. Or it might be my job to make that chemical. And so even though everyone else's exposure is really low, I might get exposed a whole lot. We call that occupational exposure. And so what we define really as the exposure event is the coming together between chemical in something that we interact with, whether that's air, water, food, product, and either us or something in the environment. And so we break down these different source-based pathways of, near-field direct is I have deliberately used this chemical right in front of me and I get exposed to it. Near-field indirect is the stuff outgassing and we're breathing in the room right now. Occupational, dietary makes sense. And then far field is actually what I thought the EPA did when I started at the EPA. And they do that, but not just that. Okay, so we can use the models that I described to you to try to predict exposure. Basically say we know there's this much chemical in a product, we know how people use the product, we know there's this much chemical in fish, we know how much fish people eat on average, and we can make a prediction of exposure that way. We can also try to infer exposure from monitoring data. And so one way I look at it, if we go back to predicting things, we could have a bag of potato chips. It can say there's 12 servings of potato chips on it, and I bring it home at night, and you can assume that I eat one serving of potato chips a day for 12 nights, and that would be an incorrect assumption, but it would be totally reasonable. What's more likely is a little stochastic. It's going to sit in my pantry for 3 nights, and then at 2 in the morning I'm going to eat the entire bag of potato chips. But there are actually guidebooks, there's exposure factors, where you can kind of get at the statistics of how we're going to do that. Or, and I'm really not suggesting anyone do this, you could develop a biomarker so that the CDC could go and say, look at how much acrylamide is in my urine, and then you could try to guess how many potato chips I actually ate last night. And so I'm not going to be willing to do that, but you might do that. And so that is called reverse modeling or inference. So you basically look at a biomarker of potato chip exposure and you infer how many potato chips I got exposed to. And the reason I bring up an example that it might sound ridiculous, but I truly don't want you to know how many potato chips I ate last night. And that is inherent to exposure science, is that we're really trying to get down to human activity. And to some extent, we're only so comfortable with having the government is never going to have perfect knowledge of human activity, I hope, even though it would make my models a lot better. So what we do instead is we start to evaluate the models with the monitoring data. So we run models in forward mode, we run models in reverse mode. And we look at basically how consistent they are. And so this is what we call the systematic empirical evaluations of model framework. So we're assuming, we're going back to this Matt McLeod point, each model represents different choices of what chemicals we care about, what processes. The model might literally be just for applying pesticides to a mattress. We want to see how well it does. So we look at as many chemicals as we can to try to see how that model performs across all the chemicals that we have available. And so Kristen Isaacs, my collaborator, came up with a really good example of hurricane tracking. We do not, or NOAA, there's no we there. NOAA, when they're trying to predict where a hurricane is going to go, does not run the perfect hurricane model. If they had that, they would run that, but there is no such thing as the perfect hurricane model. Every model for how a hurricane is going to move represents a series of choices about what's important to model. Again, hopefully nobody's making little miniature peanut butter and jelly sandwiches, but if you look at this track here, so this is an actual hurricane track from, I think, 2017. Hurricane is sweeping through the Caribbean, and so they're pretty sure that it's going to hit Puerto Rico, unfortunately, but then after that, they don't know where it's going to make landfall. And we're actually predicting everywhere from it might make landfall to Louisiana up to literally Massachusetts and Maine. Now that's the breadth of uncertainty, and you want to see all of that information. If we could just run the perfect model, that'd be great, but we don't have that. There is no perfect model. So what I want to get across is that even though we have a complicated acronym and we use a lot of models and it's a really important problem, we are basically just drawing a line through some points. SEAM is a multivariate linear regression. So we have where each point here is a chemical. We have an inferred exposure rate. So this is a dose intake rate, milligrams per kilogram per day. And then we have a bunch of different model predictions, and we're just doing a regression on them. And so we do it on the log scale for a couple of reasons that I won't go into today, but you have an intercept. That's kind of the average unexplained exposure. You have a model prediction and then some slope on that model prediction. And that's kind of the weight. So what you hope is if you spend years of your life building the model, that M here, the weight on that model is not 0. That kind of sucks, but that happens. And then you could also have other factors, like this could be, is it in the house, yes or no, 0 or 1. And so this B here just gets added to the exposure if it's in the house. And then everything else that we miss is captured by a normally distributed error term. So we're just drawing a line through the points, and we're hoping that the line goes through the points. However, and this is where the empirical aspect of things, we are also estimating the uncertainty. So the scatter of the points around this line are an empirical estimate of how bad the models that we have are available. And that's really useful information because, like I said at the introductory slides, if we can quantify the uncertainty, we can still make a reasonable comparison. So one of the problems we have is that not all models can make predictions for all chemicals. This is especially an issue when we start to run into things like the DSS Tox library, which, I don't know, last time I looked at it, had like 800,000 or 900,000 chemicals in it. Sheds high throughput, which is kind of the EPA marquee model right now, at least in the Office of Research and Development for near-field exposure, can do a really good job, but it can only be parameter only for 2,500 chemicals. I mean, that's a phenomenal number of chemicals, but that still means there's 900,000 chemicals that we can't parameterize sheds high throughput for right now. So what do we do if we're trying to do a regression on that? We have two choices. We can assign the average sheds high throughput value for all the other 900,000 chemicals, or we can assign 0. But which should we do? I don't know. So let's just go back historically and look at some of these analyses. And the irony, of course, is we didn't have the term seam when we did these first two papers, so you won't see the term seam in these papers. But back in 2013, we did an analysis. So we're looking at exposures inferred from the NHANES data, and we're looking at model predictions. And the only things that we had that were high throughput then were two far field models. So chemicals released in the environment and accumulates. And what we found is that we got a whopping R squared of 0.14. Basically couldn't predict a whole lot. And the only thing that was really predictive was a yes or no variable we had of, is the chemical in the house? And so this is actually recapitulating an older result from what was known as the team study back in the 80s, where they found the chemicals that are in the house are the ones you see in people's urine that you see in the biomonitoring data. And so that's why we have an R squared of 0.14. So that's not so great. We followed that up a year later with the second generation C model. And in that one, we actually threw out the high throughput exposure models, and we just looked at how are chemicals used in the house. So is a chemical does it have consumer use? Is it a pesticide active, a pesticide inert? What's the production volume? And interestingly, with those, so 4 of these are yes or no questions about use, and then we have production volume, how much is made or imported in the United States. And with that, we were able to explain about 50% of the variance for the average person in the United States, which is actually pretty remarkable for 4 yes or no questions and production volume. We had no idea why this worked when we did it, but it worked. What was even weirder is as we looked across different demographic groups, men versus women, children, obese BMI versus not obese BMI, basically the same parameters were all predictive. And so what we found is, for instance, so this is the regression coefficient weight. This is that slope on the, on the left hand, or what's plotted here are the slopes, how important the parameters are. And so you can see that if it has consumer use, that's really important. Well, that just recapitulates what we saw with the other one. If it doesn't have consumer use, that's actually pretty important but negative. That lowers the overall exposure. But it's basically the same across all these groups. And so that was a bit of a mystery. What we think about now, and this is based on a paper that came out the following year with Hyungwoo Shin, now at University of Texas Arlington, as the first author. What we now think is that really what that heuristics model was doing is identifying the pathways that we get exposed by. Was it near field? Was it far field? That sort of information. And so what they stated in this paper is that really the dangerous thing about doing exposure modeling is if I give you a list of 200 chemicals, which is what they had to deal with in this paper, how do you figure out how those chemicals are used? It's actually really tricky, especially if I've never heard of whatever the chemical is and I just have a structure and a name, but I know it's important. And so in that paper, they made a reasonable but conservative assumption that, well, if we don't know how it's used, we have to assume it's used every possible way, which, is a choice. And I think it's the best defensible choice, but that's still very rough. Fortunately, ORD, and this is work led by Kathy Dionisio and Kristen Isaacs, and many, many, many other people have informed this, been building a database of chemicals and products, how chemicals are used. And so the CPDAT, which is accessible from the CompTox dashboard, has lots of different types of information. And so going counterclockwise from the top, we have information that was gleaned from material safety data sheets. So every consumer products listed in a retailer, they actually say, here's the major ingredients in there, and trying to match all of that up. Then there's something called CPCAT. There's lots and lots of different categories that people have come up with for organizing the chemicals that are in things. And CPCAT basically is a Rosetta Stone that allows you to read between all those mappings so that we can use all the information that people all around the world have pulled together. You can look at ingredients lists. I don't know how many people are aware, but the ingredients on a package are required to be listed in order of relative concentration. So the first thing is usually the largest contributor. Well, you can actually put reasonable constraints on what fraction of the product each ingredient is based on its order in the ingredients list. And so that data has been used. We have, down this ES&T paper on measured data, we've actually done some suspect screening analysis. So we actually started taking products, grinding them up, and doing non-targeted analysis. And that's how we know all these interesting things about that 100% cotton shirt. And you can find, well, let's just say you've got all the rest of CPDAT. We discovered 1,600 chemicals that we were pretty sure what they were in 100 consumer products, so that's 16 chemicals per product. 1,400 of those were new chemicals to CPDAT. So we discovered 1,400 new chemicals. Now, these are not unreasonable chemicals. It's not like we discovered weirdo chemicals in there, but basically these are not things that we had listed previously. That's now in CPDAT. And then Kristen Isaacs and Catherine Phillips have compiled a lot of data on how chemicals are used. Is this a solvent? Is it a dye? Is it a perfuming agent? And they've actually built models where you can give a chemical structure and you can predict what that chemical is doing in there. And that actually also, that's directly correlated with how much you have. If it's a solvent, it's going to be a whole lot. If it's a perfuming agent, hopefully it's not too much, or else we'll all be sneezing. And so you can actually make those predictions. So to do a third generation SEAM model, we had CPDAT. We have a collaboration on high throughput exposure. And so we have here, I believe the number's 12, I haven't counted recently, 12 different models and sources of data from various collaborators who have all listed up at the top. Hopefully, if I've omitted anyone, I apologize. But people from across the world, various academic groups, government groups, all sorts of different types of models. Some of these are near field models, some of these are dietary models, some of these are far field models, trying to pull all this information together. And so I'll just quickly review a couple of the models. So this, oops, sorry about the title there. I'll correct that before we send it out. But Office of Research and Development at the EPA has a model called the SHEDS High Throughput, or Stochastic Human Exposure Dose Simulator. Richard Judson at one point kind of described this model as like a game of Clue. You simulate it. It's Colonel Mustard is in the library, and he's got, the lead pipe, so he's getting exposed to lead. If you don't keep lead pipes in your library, you won't get exposed to lead in the library, hopefully. What makes SHEDS work, among many things, is that it is backed by a massive diary, or a massive library of diary entries of what actual people were doing on a small granularity of, now I'm taking a shower, now I'm in the kitchen making a sandwich. Now, basically you have that information so that you can actually parameterize an environment and say, my chemical, well, you're getting exposed to in the shower, it's not in sandwiches, but it is in the couch. and simulate days for individuals and start to get an idea of what the exposure is. All this is available as an R package and many publications on sheds in general, but the high throughput sheds that Kristen Isaacs led has a publication back in 2014. So that's a near field model. We also have lots of far field models. And the cool thing about far field models, I don't know how many of you are familiar with physiologically based toxicokinetic modeling, but they're basically very, very similar spiritually. You're describing a chemical and it partitions into the environment. Based on its log P, it might be more likely to go into dirt. Based on its vapor pressure, it might be more likely to go into air. And you simulate the release of the chemical in the environment. And then typically these models are coupled to exposure factors, again, of how much water do we drink, how much fish do we eat, how much meat do we eat, and so you can make a prediction of exposure that you get. So use tox is one, came out of United Nations and CTAC, and it is itself a consensus model in the sense that they had a whole bunch of diverse modelers get together and kind of argue what should be in a model and what should all be included. There's a second model that we look at called radar. Spiritually, it's somewhat similar to use tox. It's not identical. But radar is actually kind of the next generation version of a model that EPA uses called EFAST to do general population exposure. And so they've got a nice diagram. John Arnott's the lead author on this. Chemicals released, is it released in the soil, air, water, and then where does it go upon the release? Where does it partition? And again, it has food web bioaccumulation. And so you can radar can estimate how many milligrams per kilogram body weight per day we get exposed due to an environmental release of a chemical. So how do we pull all this together into scene 3? So I really, really hope you like this figure here because you're going to see it like 5,000 more times in the remaining 20 minutes here. So the basic idea is that scene 3, we want to predict the total chemical intake rate, but we've started to divide that into pathways. So you have a consumer pathway, a dietary pathway, far field pesticide use, far field industrial use. We ask a yes or no question. Is that pathway relevant for that chemical? And it's still tricky. I've deliberately not told you how we're answering that question yet, but for your chemical, if it's a pesticide, then its answer is yes, it might have far field pesticide use, unless it's a pesticide we use in our house, and then it has consumer pesticide use. Or we do both, it could be yes on both of those. It does not have to be uniquely yes or no for any one chemical or any one scenario. And then we have all these predictors. So these are these 12 predictors that I told you. It seems like more than 12 because some of them predict multiple things. First off, we have, so consumer, we have shed side throughput. There's a model FINE. Radar ICE, which is a near field version of radar. Use tox has a consumer prediction model. Oh, sorry. For dietary exposure, shed side throughput has a dietary model. There's actually a food contact substance migration model. Daria Burial is the first author. That's an ORD model. And then use tox and radar describe kind of pesticide residues, those sorts of, or not pesticide, but residues, pesticide residues, and things should be covered in use tox and radar for the pesticide exposure. We also have the Stockholm Convention. That's a list of banned persistent chemicals, and there it's just a Boolean factor. If you're on the Stockholm Convention list, that chemical should be banned. Hopefully you're not getting exposed to it still. We also use the Stockholm list for industrial chemicals, and then use tox and radar really modeling industrial exposure. Now, how do we add all these models up? Well, we subtract the mean off each model, and we divide by the standard deviation. So that's called, they're centered and scaled. And so what we're doing is we're saying each model tells you really how many standard deviations above or below the average sheds chemical is this chemical X. I'm exposed to chemical X. Is it a really high chemical or is it really low? And we roll all those together, and then the other terms here that we have is the average unexplained for each pathway. So if sheds is perfect, this average unexplained should be 0, and we just go with sheds, and that's life. But no model is perfect. That's what I tried to introduce you to early on. No model is perfect, so we have some average unexplained exposure, and sheds pushes you either above or below that average. And then we have other pathways. I can come up with 2 or 3 other pathways off the top of my head. So you have exposure from other locations. All right, so this is a big chart. To evaluate this, we are going to use the urine, blood, and serum data from NHANES. So NHANES urine has been thoroughly analyzed both in the Scene 2 paper, and then Carolyn Ring actually published it as supplemental tables in a 2017 article. We also have blood and serum data. We use the high throughput toxicokinetics or HTTK-R package, except for those chemicals where the high throughput toxicokinetics R package doesn't work. And notably, that's PFOS, PFOA. There's a couple others where you might not want to use it. In that case, we use a clearance from the literature. But otherwise, I tend to trust the HTTK package for reasons I won't go into here. What we get out of that, and this is just a blow up, is that we actually have 8 orders of magnitude, ballpark, well not quite. Yeah, 8 orders of magnitude of intake rate that's inferred. Some of these are really precise, like diethyl phthalate. We have a pretty precise estimate on because there's a metabolite, monoethyl phthalate, that if you see monoethyl phthalate in your urine, you got exposed to diethyl phthalate. Things get interesting, or things get easy. There's other chemicals. There's, for instance, whole class of pesticides that all share the same biomarker, so they all have the same metabolite. Well, the CDC just wants to know if you're exposed to any of those pesticides, so they just measure that one metabolite, which is great for the CDC's purpose. They can say, yes, you were or weren't exposed to pesticide. Makes life very hard for me to do inference, so that's where you get a lot of uncertainty. But you can still see across these that you have a whole lot of things that we have an exposure rate on. So everything that we saw in urine is the triangles. Now, if we look at the bottom of the chart, we start to see more of the chemicals that are in serum. So we get down to PCBs and these really bioaccumulative pesticides. Why does the CDC look for them in serum instead of urine? Well, it's because they have really long half-lives. If you looked in urine, you wouldn't see anything. They're not coming out in urine. So the CDC knows exactly what they're doing. We would expect to see the serum chemicals down at the bottom of this chart, kind of blended in here, and the urine chemicals up at the top of the chart. So that makes sense. It's a nice reality check. So this is the same diagram as before, and I'm just saying these are the evaluation chemicals that we have in order to check whether or not our models are working. Okay, so here's our models. What we want to look at, and this is where we start to have fun, is how do we figure out what's going on with whether or not a chemical is used. And so likelihood of exposure via various pathways predicted from production volume, the opera phys-chem properties, and toxprint structure identifiers. And we use machine learning, particularly the method of random forest, to generate a chemical-specific probability that exposure happens by a given pathway. And that's fed in as a prior. So if we're 90% confident that it has dietary exposure, the prior is that it's yes with 90% chance, no with a 10% chance. And so machine learning here is basically allowing us to answer those questions. That allows us to stitch all of these models together appropriately depending on the chemical that we're interested in. Oops. Okay, so we actually perform Bayesian analysis via our Markov chain Monte Carlo, and this always has a value of yes or no for each pathway. And if the pathway is no, nothing gets added for that chemical. Now we use then linear regression on these things. If it's yes, then we're actually regressing on the predictions of all those models. Now the model predictions themselves, I told you, are centered at 0. So we kind of add the average value if we think that pathway is relevant. So this is the answer to my question, if sheds can only work on 2,500 chemicals, and again, it's ridiculous to say only when it's 2,500 chemicals, but for the other 900,000 chemicals, you assign the average sheds value if you think it's a near-field chemical, if it's used in the house. And if it's not used in the house, if my machine learning model says it's not used in the house, you don't add anything for that pathway. And that's basically, this is the trick that makes SEAM3 work, is it's a slightly more complicated linear regression. It's still just a linear regression. So we've got all these models. This is SEAM3. Let's go back and look at SEAM1 then. So this is the model where we had a really impressive R-squared of about 0.14. That's terrible. And we showed that the far-field models didn't work so well, and really the only thing that seemed to work was, is it in the house or not? Well, this is what SEAM1 looks like according to that diagram. First off, I hadn't thought anything about pathway relevancy. So the answer was all chemicals are consumer chemicals. We didn't worry about dietary yet. All chemicals are also pesticides. All chemicals are also industrial chemicals. And then we said, well, how well does use tox predict all these chemicals? Well, it actually turned out that a lot of the chemicals the CDC looks at are near-field chemicals. So we judged use tox on how well it was based on completely inappropriate chemicals. So that's why you would find that these far-field models didn't do such a great job of predicting things. Ended up with a model that kind of worked. But just want you to know that basically SEAM3 is compatible with SEAM1 there. All right. So this is SEAM3 again. Let's go back to this heuristics of exposure that we didn't understand. Well, we kind of feel like it's the pathways. Remember, this is just 4 yes or no questions and production volume. Well, basically, what we had were the answers based on active use database gave us the answer of which pathway was relevant. And then we were just adding an average unexplained value for each of those pathways. And so we saw things like the average unexplained value for consumer was high. If you had a consumer exposure, that increased your exposure overall. Oh, sorry. And if it was a far field exposure, it was lower. So SEAM2 is completely compatible with SEAM3, except it didn't have any models incorporated in there. But we got an R-squared of 0.5, so that's something. All right, so this is SEAM3. So how well do we predict exposure pathways? Well, we use random forest, and the trick to any of this is that we need examples of chemicals that do have exposure by a given pathway. The dietary is actually pretty easy in some respects to get positives. There's a whole FDA list of things that we eat all the time, cumulative estimated daily intake. There's NHANES curation. There's the CPDAT provides information. Far-field pesticides, we have several lists. Far-field industrial was a little bit more complicated, but we were able to find things. The really hard thing was finding sources of negatives. How do I know something's not in food? Is that just because it's not on a food list? Well, what about, say, bisphenol A? Nobody deliberately adds bisphenol A, but if I drink a can of Coke, and I have been known to do that, and it's in the lining of the Coke, and the acidity of Coke is 2.5, or pH 2.5, I'm getting some bisphenol A in me. So figuring out the negatives was tricky. What we largely relied on was a list of pharmaceuticals and said, well, pharmaceuticals are not normally dietary. But we built the models, and the important thing is that the balanced accuracies of these models ranges from 73% to 81%, which is actually pretty darn good for just going from structure and phys chem to predict how a chemical is used. For those of you who really, really care, what properties were important to the models? Well, it varied a little bit from models. So if I was going to pick for everything but the near field pathway, the air-water partition coefficient was the single most predictive thing. For near field, vapor pressure was a little bit more predictive. But things like melting point, vapor pressure, good old log P, or octanol air, molecular weight, all ended up being predictive. So this is not a big surprise. Like physical chemical properties make it appropriate for use in one thing or another. What do we get when we do this? When we put this all together, we now get an R-squared of about 0.81, which means we're now explaining 80% of the chemical-to-chemical variance in the average exposure, but across all of these NHANES chemicals. That's using the machine learning pathway predictions and then using these 12 different models to make predictions. And so what's cool, and it's a little hard to see here, but a lot of the chemicals have multiple uses. So if it's a circle, it's only got consumer use. But you see we actually have like some chemicals that are these upward triangle. They have dietary, consumer, pesticide, and industrial use. But that happens. And this is the NHANES data that we're looking at here, and that shouldn't be a surprise. NHANES is going to be really interested in a chemical that has dietary, consumer, pesticide, and industrial use. But basically, we're explaining about 80% of the variance, or root mean squared error is about a factor of 10. This is not a perfect model, but this is pretty darn good for, what we got. What models matter? We put this in just because Kristen's here now, but what models matter? Sheds Direct actually has a very significant weight in predicting that a chemical is going to have a higher or lower exposure. The different pathways so things that are in bold were statistically significant. So if something's in your food, it turns out you get exposed to it. If something is in your house, it turns out you get exposed to it. If something is a pesticide, it turns out you get exposed to it. So what's interesting, and this is a problem that I think I understand. So we had the food contact model of how things migrate into food, and then we have these far field models. The radar use stocks are statistically significant as long as you do the opposite of what they say. Now, there's a reason for that. I think I've got this worked out. What are the worst chemicals? They're PCBs, they're dieldrin, they're DDTs. Radar looks at one of those and says, holy crap, you should have a ton of that in you. Except we've banned those chemicals. So we as humans have gone out of our way to make life hard for models like radar and use stocks to look right on an evaluation like this. So That's why we included that Stockholm list of what's been banned. And you'll see if it's been banned in particular, then you get a really, really significant lower exposure. So I actually think radar and USTOX are correct. It's just that we've been evaluating them on chemicals that we've messed with. You know, it's kind of like pulling the football up from them just as they're about to kick. And, you know, that's what we see. So Carolyn Ring and I, so Ring et al., Carolyn Ring is the postdoc who's the lead author. Not postdoc, she hasn't been a postdoc for years. She's a tox strategist now and is a highly accomplished scientist on her own. She is first author on this paper. We applied this to every structure that we could pull out of DSS Tox as of, 3 months ago. Knowing Tony and company, we're now horribly out of date because it's been 3 months. We looked at 687,000 structures. Of those, we had 480,000 that fit in what we call domain of applicability. Now, what that means is that there were about 200,000 chemicals that didn't get predicted to be exposed by any of those pathways. And that doesn't mean it's not a pharmaceutical or an industrial chemical or something else that we haven't modeled. But for the chemicals that we do understand, we were able to identify almost 2,000 chemicals where there's some probability, so this gray line is the 95% confidence or credible interval, some probability that exposure might exceed 0.1 milligrams per kilogram body weight per day. At the same time, they're able to identify 475,000 chemicals where there's 95% confidence that exposure will never exceed, actually 1 microgram per kilogram body weight per day. So yeah, there's a lot of uncertainty. This is on a log scale. Those confidence intervals are huge, but we're actually 95% confident for the average person. If you're in a factory and you make this chemical, we're not talking about you, but for the average person, these are not chemicals that we do need to worry about. These other 1,880, it's worth investigating. So this has been fast. I'm had a bunch of caffeine and I'm talking at you as quickly as I can. If you'd like to know more about this, like I said, Carolyn Ring just published a paper. It is online at ESNT. I imagine it's in press, but I haven't picked up a paper journal in a long time, but it has lots of additional information on how this all works. I really have to acknowledge, you see all those modelers up there. These are people who are willing to give us predictions, and then I say snotty things like, and then you do the opposite of what they say, you get a good prediction. These people are saints because a model is like, if I made my model train and you came in and said, yeah, that's horrible, I'm never going to use it. It's been very nice to work with all of them. If you really haven't had enough, there will be a continuing education course bright and early at 7 a.m. at SOT in a week and a half. Kristen and I will both be there, again, really wired on caffeine, I presume. And you can register at SOT to attend the class. That means you actually have to get there earlier than 7 a.m., so you must really want to know about this stuff, but it's doable. Last thing I just want to say, this is how it all looks when it comes together. This is CompTox, right? So here's actual ToxCast plus high throughput toxicokinetics, giving you how many mgs per kg per day do I need to get a chemical exposure. This is work by Carolyn Ring on this is actually CM2 numbers, but how much it comes together. And what you can see is, so we have orders of magnitude of uncertainty for some of these exposure estimates. We literally don't know within a factor of 1,000,000 where the heck the exposure rate is. But we are pretty confident that there's a factor of 100 million between exposure, even the worst case exposure, and biological activity. So if I were a postdoc and you told me I'm going to study a chemical, but there's like a margin of 100 million between this chemical's potency and any activity, I'd be really upset. Oh, I went forward. Yep. All right. One other thing I want to touch on is in past SEAM analyses, we have looked at demographic groups, variation between women and children. We have not done that yet for this third generation SEAM model. If you are a graduate student and you're finishing up your PhD and you'd like to do a postdoc on doing this is a project that needs to get done, but it hasn't been done yet. So we don't know are men or women going to get higher exposure or children going to get higher exposure yet with this new model. So just to summarize, we can make chemical-specific estimates of intake rate for hundreds of thousands of chemicals basically from the structure. The more models we have that have predictions, the better off we are. Every model is a different take on how the world works, and the real trick is trying to figure out which model to use and when, and that's where our machine learning models of pathways really help out. We are using existing chemical data to predict the pathways. We really need better data to characterize all that. What's in consumer products? Like I said, looking just at 100 consumer products in a non-targeted way, we discovered 1,400 new chemicals. That data informed our ability and expanded our domain of applicability. We still have several 100,000 chemicals that we can't make any prediction for. So if you can do non-targeted analysis and figure out what bins those other 100,000 of chemicals go in, then we can start to make exposure predictions. Eventually, we've got to get go beyond NHANES. I am well aware that we are extrapolating from 100 chemicals to hundreds of thousands of chemicals. That definitely doesn't make me feel great. However, that is the best thing we can do right now. And so again, non-targeted analysis might help with that. The problem, and I mentioned this earlier, and this is a nice paper from Steve Rappaport. If you look at blood, you see blood. This is concentration. You have to get way down past the blood to start to see what he calls the pollutants, but are really just the chemicals in our environment, environmental chemicals versus blood and food and whatever I ate at Starbucks this morning. Final thought, this is from Naomi Oreskes. Scientists should resist the demand to describe any model, no matter how good that model is, as validated. Rather, we need to talk about strategies rather than talking about strategies for validation, we should be talking about the means of evaluation. And so that's where SEAM is all about evaluating the models that we have. I do not want to discourage anyone from building bigger and better models, but the way we use those models is to evaluate what they can do. Just want to acknowledge dozens of people who have helped this. I already said all those modelers on the right-hand side and our collaborators have helped out. We have people from 4 different labs and centers here at EPA who have informed this. And here's all the references, and Sammy will circulate these slides for anyone who wants to see them. All right, I've left myself about 3 minutes for questions.
Okay, let's see. So if anyone has any questions, feel free to just put those in the chat for us right now. We can stick around till about 12 if anyone is still thinking.
Yeah. So if I understood that correctly, you tested the model kind of by comparing to serum and urine levels.
Mm-hmm.
So basically, we only know how much of the chemical gets out of the body again. Like if it sticks somewhere in the tissue,
mm-hmm.
you could take a lot, but it will never appear
yep.
in the excretion. So is that a concern or?
Yeah. Okay, so the question is, right now we're focusing on serum and urine. If something's persistent and bioaccumulative, what do we do about that? And so that's actually what we're using HTTK for. So every chemical that we run through HTTK has, we predict what's called a volume of distribution. And so if you have a fat-soluble chemical, you may actually have a really, really large volume of distribution, and actually things like DDT and PCBs are chemicals like that where if you see a micromolar of that chemical in the blood, there's actually tons and tons of that chemical in the body. Now, for this analysis, we're not actually then thinking about what target tissues we worry about, but we do include that volume of distribution to estimate the clearance from the body. So we know how fast or slow. So something that distributes very heavily into the body is going to end up with a much slower clearance than something that, like some of the phthalates and things, our body doesn't seem to really store them, so they're out of us. And actually, even talking about steady state phthalate exposure a lot of times doesn't make a whole lot of sense, but it's better than nothing. So we take that into account from the exposure end to some extent. From the tox end, we're just starting. We can do it, but we need to know which tissue we care about.
Cool. And so we have a question from the chat. Someone wants to know on slide 21 and 42, why is there a difference in R values between pesticide actives and inerts?
My favorite question. Okay. Yeah, no, this is a great question. When we did the SEAM2 analysis, we just used these yes or no questions. And so there was a question, yes or no, is a chemical a pesticide active? Yes or no, is it a pesticide inert? Doesn't seem like a big deal. If a chemical is a pesticide active, your exposures in NHANES are lower than the average NHANES exposure. Again, that just says we're doing an okay job regulating pesticides. If your chemical is a pesticide inert, you have a higher than average exposure to that chemical. And that would seem to make absolutely no sense. And we definitely worried about that for a little while. How can an active mean lower and an inert mean higher exposure, until you start to look at what the list of pesticide inerts are. So remember on one of the first slides, I said there's different reporting requirements for pharmaceuticals, food ingredients, and pesticides. If something's in a pesticide, we have to know all sorts of things like what the binding agents are, what's in the freaking bag of the pesticide. So we end up with phthalates and things like bisphenol A and stuff that are pesticide inert ingredients. The thing about those chemicals is that there's nothing unique to pesticides. We make plastic bags out of the same stuff we make plastic bags for anything. We just, at that time, only knew about them through the fact that pesticides had the higher reporting requirements. So pesticide inerts actually turned out to be the sort of chemicals that CPDAT now does a pretty good job of covering. And that was something that led us to it. But yeah, that was a real head scratcher. So yeah, in quotes, pesticide inert is actually a chemical that has a broad range of uses because it's inert, whereas a pesticide active is the thing that kills things, and that's highly regulated and usually a lower exposure. Good job to whoever was actually looking at the regression coefficient.
Okay, let's see. I think we got a couple people typing right now. We got a thanks for answering that question.
You're welcome.
I have a question.
Yeah.
So obviously the R squared has improved dramatically, but I'm wondering about your interpretation of the R squared. So you had said something about using the logs on the predictor variable, for example, and you didn't want to talk about it or go into it at the time, but I wonder how that affects your interpretation of R squared in terms of like this is 80% of the variation.
Really what you care about is the root mean squared error. And so the main thing with the logs is that actually allows all the predictors to be multiplied by each other. So for instance, production volume is a predictor. All of the use tox and radar models need to know what the release is to the environment. How much of this got dumped in the environment? We just simply don't know right now. So right now we use production volume as kind of a surrogate for that, which is a very wonky. I'm not happy with that. We do have some efforts to try to build better release models that can be run on 900,000 chemicals. But what the root mean squared error, there's right about 1. And that there the interpretation, because we're on a log scale and a log 10 scale, is that that's a 10-fold error up and down. And, in my background, I'm really happy with a 10-fold error up and down. Now, again, if I were the manufacturer of the chemical, I might want to know it a little more accurately, but hopefully I do know it more accurately than that. But for high throughput, I think, root mean squared error is really the thing you want to use. It's just R squareds have they roll off the tongue better, and they keep approaching 1, so,
Okay.
I was also wondering, I think you use the binary classification to say, yes, it's in a consumer product or not. What if you have like 60% confidence that it's in and versus it's not? Would it not maybe make sense to use a weighted approach, saying, okay, we have some evidence it's in there?
So what do we do if we have a prediction from our chemical use model that it's 60% in a consumer product? And that's where we do the markup chain Monte Carlo. And so we actually use that 60% as a prior. So we think there's a 60% chance it's a consumer product. And then we actually do millions of simulations. Sometimes we simulate, 60% of the time, we simulate that, yes, it's definitely consumer products. And 40% of the time, we say, no, it's not in consumer products. And when we do that calibration to get that R squared of 0.8, when we look at these things, that's exactly what we're using both when we do the regression, and then we use the same probabilistic approach when we make our predictions. So that's why you get those large confidence intervals, because most of the time, it would be great if the model was always 0% chance, 100% chance. Most of the time, it's 60% chance of this. So 60% of the time we simulate it like it's a Sheds chemical, and 40% of the time we don't. That's also why, and this is really important, for the 100,000 something chemicals that don't match any pathway, we just don't touch them. I don't think it's fair to say that, we're really confident that they're not used in those ways. I said we're bad on the negatives. Those chemicals are outside the domain of applicability. And for example, pharmaceuticals would be a chemical that we both have delivered exposure to, and we actually get a lot of environmental exposure, because any pharmaceutical I don't metabolize, the The crude way to put it is the FDA's problem until I use the toilet, then it's the EPA's problem. But that's very true, and we see those chemicals in the environment, and I haven't modeled that pathway, so that's one that we haven't included yet, so we need additional data to build out the pathways. I'm also not really knowledgeable about exposure pathways, so there might be a totally different way to break down the pathways that does a better job of building the models. But at any rate, the stuff I like is exactly the question you asked of how do I deal with something that I'm only 60% sure of.
John, just to follow up on that. So
yeah.
Just to make sure I understand. So that 60% is, let's say you're doing like a Monte Carlo sampling of that 60%.
Mm-hmm.
You're not actually like updating that to some sort of posterior through more information.
That's right, because so for the DSS Tox library, I don't have any more information.
Yeah.
So I just take
all
that
information in a random forest model, and then that is just kind of like, okay, we're going to sample. We're going to do random sampling from that 60%. And we can make our spaghetti model from that.
That's right.
Okay. It doesn't look like we have any questions right now, but I think Jacqueline Fisher wants to possibly connect with you offline because they're conducting some NHANES population-based studies in the Great Lakes right now. I think that might be interesting to talk about. So, yeah, just reach out to me or John Wambaugh. You can get me at hamp.alexander@epa.gov. I'll put my email address in there. I guess, and so we're going to wrap up. Thanks so much, everyone, for joining us. Be sure to tune in next month, March 28th. We're going to have a presentation by Drs. Anthony Williams and Katie Paul Friedman on the new features available in the chemicals dashboard and in vitro DBV3. It's going to be very exciting. I wouldn't want you to miss it.
Thanks.
Thanks, everybody.